So with non-scheduled cases, it's very important to understand how these cases work, because insurance companies will often fight these claims more than other injuries because there's a few more avenues for them to try to minimize your value. And we want to talk about what we can do to maximize your value so you can come out on top. Most injured workers don't realize this, and they end up with fewer benefits than they deserve and then that they're entitled to. So if you have a non-scheduled type of injury, a head, neck, and back case, things like that, this is a live stream you're not going to want to miss. So let's jump right in. As always, folks, I got some slides we're going to discuss, and I'll take your questions all in due time. But thank you. I see a few questions already popping up. PM Gallery always has good questions. Natalie has some questions for me. I'm going to get to all of them. So let's start off with, what is a non-scheduled loss of use case in the workers' compensation world? What makes a case a non-scheduled case? Non-scheduled cases usually cover injuries like spinal injuries, neck and back. Some people don't realize you have 3 different areas of your spine: your cervical spine, the neck, your thoracic spine, which is the mid-back, and your lumbar spine. Thoracic spinal injuries are relatively uncommon. Most of the time when people hurt their spine, they hurt their neck and their low back, cervical and lumbar. But it could be anything. Pelvic injuries. Now, pelvic injuries, you need to distinguish between a pelvic injury and a hip injury. A hip injury could be construed as a leg injury, which is a schedulable injury, which is what we talked about yesterday. And as always, folks, if you have questions about what we talked about yesterday, questions about anything when we're done, we'll hit all the topics. But a hip injury could be a leg, which is a scheduled loss of use type of case. A pelvic injury, pelvic fracture, things like that, could be a non-schedule, and you could have both. You could have an injury to the pelvis that affects the hip, and it could be a non-scheduled pelvic injury plus a schedulable hip injury, which would be a leg. Sorry, it's been a crazy day, and I'm dehydrated. Lungs. We respiratory issues. We have a silicosis, a big silicosis case that we're fighting right now. So lungs, heart attack cases. We've done heart attack claims before, stroke cases, traumatic brain injuries, concussion, post-concussive syndrome, other internal organs. If you have any type of work-related dysfunction, those would be non-schedulable cases. Psychological disabilities are considered non-scheduled cases. The main differences between a scheduled case and a non-scheduled case, the calculation method. Non-scheduled awards are based upon your loss of wage earning capacity rather than the injury to the specific body part. They look at your loss of wage earning capacity. When we're determining permanent disability, we look at your impairment overall, your overall loss of wage earning capacity. And lost time is another main component. So just because a person has a significant spinal injury, they could have a debilitating spinal injury. Theoretically, we've spoken about this in the past, and I've used this example. You could fracture your spine and you could be in a wheelchair, and your boss could say, man, we feel so bad that you had this horrible accident on the job. Rather than have you do your old job, you're going to come sit and work in the office with me, and you can sit there and answer the phone, and I'm going to pay you the same amount I always paid you. In the eyes of the law, you're not disabled per se. You have no diminishment in your wage earning capacity. You might have the worst injury in the world. You're wheelchair bound, but if your earnings did not suffer, then there's no loss of wage earning capacity. You wouldn't receive ongoing benefits, presumably under that set of circumstances. So something to consider. Whereas you could fracture your arm, whether you go back to work the next day or you never go back to work, the value of that arm injury is the value of that arm injury. And it's the value is based upon how much permanent disability you have. So very different from what we talked about yesterday. Payment duration. So once a loss of wage earning capacity in LWEC has been determined by a judge, that corresponds to a set, we call it the cap. Non-scheduled benefits are payable for a maximum number of weeks determined by your loss of wage earning capacity percentage. And I'm going to give you a quick breakdown on that in a minute. Where is that? It's over in slide number 3. We'll talk about that in a minute. Complexity. Non-scheduled cases are often more complicated and frequently contested by workers' compensation carriers. Listen, they're gonna controvert and contest your schedules, and those are a lot easier to decipher. You know, if a person's their range of motion is their range of motion, and it should be pretty black and white. Non-schedule, there's a lot more that's considered. not only do they consider the permanent overall impairment that you have on the whole, but your vocational background is also considered. So there's a lot of gray area. There's a lot of room for interpretation. There's a lot of room for influence. So testimony is important. And there's a lot of room for a judge to make a decision that you may or may not like. So you got to be very careful with non-scheduled permanency cases. Payment after death is another big difference. If you have a schedule loss of use assessment or a schedule loss of use determination and you haven't gotten paid and you drop dead, that money is still payable to your estate, to your family, to your heirs, to whoever gets your money. Conversely, on the flip side, on a non-scheduled case, if you're found to have a 75% permanent disability and that gets you 400, I'm cheating, that gets you 400 weeks of compensation. If you drop dead 200 weeks into that payment cycle, that's it. No more money to your family unless your death is related to the accident and the injuries. So if you have a heart attack case or a brain injury case, and your ultimate demise is the result of those unfortunate injuries, then you could pursue a cause-related death claim. The compensation would stop, but then your family might be entitled to different compensation based upon the causally related death. Plus 100 is flowing with questions. You're on a run, my friend. I'm going to get to you in a minute. How is a non-scheduled loss of use determination made in workers' compensation? And what happens if the insurance doctor disagrees with your doctor? So how is a non-scheduled loss of use determination made in workers' compensation? It's a lot more complicated than a scheduled loss of use. And just like the scheduled loss of use, you can go to the Workers' Compensation Board Medical Treatment Guidelines for Determining Permanent Impairment. That's the name of the book. Great title. You can go check out the book and go to your body part section. There's a chapter 11, spine, and you can read up on how they assess your permanent disability. And essentially, they utilize a point system. You get X amount of points for subjective complaints of ongoing pain. You get X amount of points for positive diagnostic testing. You get X amount of points for positive MRI. You get Y amount of points for objective findings. You go to a different chart and a different table if you had surgical intervention, and blah, 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 blah. And they go on, and it's a whole drawn-out process that the doctors have to follow to reach their conclusions as to what your permanent disability is. And once they do that, they assign you a letter grade. And I'm not going to get into why I think the letter grade system is horrible, but they assign letter grades now. And whether it's my opinion or not, the letter grade leaves a lot more for interpretation by the judge. If a doctor says you have a 60% permanent disability after I've done my full examination, the 60% is pretty clear. If the doctor says that I've done my examination and you have a D, well, what the hell does that really mean? And unfortunately, a D could mean a lot in one case and it can mean very little in the next case. And it's very confusing. So it leaves a lot to interpretation, which is why it's important that you have an attorney who could try to make that D a significant D. We should use E instead. You know what I mean? But we want to show that your injuries are as severe as they truly are, so you can maximize dollar value. That's why it's important to have a lawyer who knows what they are doing. It's important, and that's what I do. And if you need help, you can call me, 212-406-8989. By the same token, your doctor's going to do their evaluation. They're going to figure out what they think your overall permanent impairment is according to the guidelines. And the insurance company is probably going to send you to see one of their consultants, and they're going to do what they think is right. And just like a scheduled loss case, sometimes your doctor is here and sometimes their doctor's there. And that's where we come in and we try to bridge that gap and get you as close. We try to make the bridge a lopsided bridge that's more travel from the bottom up than from the top down, if you know what I mean. But we try to get you as much money as we can get you based upon what the medical reports say. Now, like I said before, in addition to determining your permanent impairment, your permanent disability from your non-scheduled injuries, these head, neck, and back cases, what else becomes a factor? Your vocational background becomes a factor. And I always use this example, and maybe it's a horrible thing, but this is the example. If you have two people the same age the same body type, and they both have the same exact injury, and they've both been assessed to have the same level of permanent disability because of that injury. Okay? They both have an 11.1 table severity ranking E. And let's just say that corresponds to a 50% permanent disability. Okay? Identical, let's say they're identical twins. One of those two people has a Harvard education and speaks 17 different languages, and has all sorts of phenomenal training and served in the military, and they're a math whiz, and they have all this. They're a genius, and they could do it all. That's person number one. Person number two, who has the exact same injury, can't read or write. He can't read or write, never got any formal schooling beyond the second grade, and the only job that person's ever had is sweeping floors. Well, if you look at the vocational background of those two people, clearly person number one, the brilliant multilingual astrophysicist, is going to have an easier time finding future work despite his injuries than person number two. So their vocational factors may be aggravating, and they may be a non-aggravating factor. So despite the fact that they both might have a 50% permanent disability, person number one might actually be considered to have a 35% permanent disability because of their vocational background, whereas person number two might have a 75% or a 90% permanent disability based upon their vocational background. So vocational background is a very important factor when it's time to determine permanent disability. Another part of that is also if you have any comorbid or unrelated medical conditions. So we've seen this a few times. We've had clients who might have a permanent partial disability, and their vocational background might be whatever it is, but they're in the process of undergoing chemotherapy for an unfortunate cancer, and that might deem them totally disabled under their set of circumstances. So it's something to consider as well. It's not considered during the temporary portion of your case while you're still healing and getting better, and when work search is a factor and all those sorts of things, although it can be brought up. But at the permanency stage, those unrelated medical conditions could be brought in as aggravating factors that would increase your loss of wage earning capacity. Whew. Man, I am thirsty today. You guys are like a VA Murph, Va-Murph, Oscar RF. You guys are asking questions in spurts. Pardon me. How do you calculate a non-scheduled loss of use case in workers' comp? And are there different values for different body parts? So no, there are not different values for different body parts. We look at the person as a whole. Your weekly benefit amount is calculated as 2/3 of your average weekly wage. That's how we determine your total rate of compensation. You're entitled to 2/3 of your gross salary, your average weekly wage, as we figure it out in court, times your loss of wage earning capacity percentage. So it's a percentage of that total. And the number of weeks that you get that amount of money is based upon how severe your injury is. So the more significant, the more severe your level of permanent disability, the longer you get benefits. So just for instance, for an example, if you have 15% or less permanent partial disability, you get benefits at whatever rate that's set at for 225 weeks, for no more than 225 weeks. How about that? If you go back to work, light duty, those benefits will change or stop completely. And then it's a tiered system from that point on. So if you have 15 through 30% loss of wage earning capacity, you get 250 weeks, no more than 250 weeks of compensation. 30 to 40% gets you no more than 275 weeks of compensation. 40 to 50% gets you no more than 300 weeks. 50 to 60% is no more than 350 weeks. 60 through 70, no more than 375 weeks. 70 through 75% is no more than 400 weeks. And it goes up. The highest tier is 95%. If you have a 95%, if you have greater than a 95% permanent impairment, you would get 525 weeks of compensation. And then if you are totally disabled, if you have a permanent total disability, you do get benefits for the rest of your life. So back in the day before the laws changed, it used to be that if you had a 50% permanent disability, you would get the 50% rate for the rest of your life. But now they put caps on how long you can get that. And just for a better understanding, because usually when I give this little comparison, people kind of, the bell rings in their head. A 50% disability gets you 300 weeks of compensation. That is the equivalent of 5.77 years. So when I tell somebody they're going to get benefits for 300 weeks, they look at me like I have 17 heads, because what the hell is 300 weeks? If I tell them they're going to get benefits for 5 3/4 years, they go, geez, that's not that long a period of time. I go, yeah, you're right. A 75% disability, 400 weeks of compensation is just under 7.7 years. So 75% permanent disability, permanent loss of wage earning capacity, it's a pretty significant finding. And you're only going to get benefits at a rate significantly reduced. You're going to get half of what you were earning, potentially, depending on if you cap out or not. But a 75, this is what you need to think about. If you have a 75% permanent partial disability, loss of wage earning capacity at 75%, and your salary is not high enough that the statutory cap is going to play a role. Let's just say you earned $1,000 a week and you've been deemed to have a 75% permanent impairment. You're going to get $500 a week for the next 7.7 years. And that's all she wrote. And that sucks. Because if you're a 30-year-old guy with a family getting half your salary for 7 years and nothing else, and then you're left with a 75% permanent disability, you do the math and you tell me how that person is going to be able to get back to a place where he could support his family and live a life that he was living before he had this unfortunate accident. I think it stinks. But that's also why sometimes it's worth considering settling a case like that, because maybe you're not going to get all that money. You're not going to get that 400 weeks of benefits paid to you in one shot. Maybe they're going to discount it, and maybe you'll get somewhere around half of that money upfront in one shot. But if you invest it wisely, if you're smart with your money, you can do things with your money that will build and earn on themselves and help you, and potentially you get yourself back in a place where you can find a different job or do something with your life. That money could help you. So that's really where settlements, in my opinion, are most valuable. Yeah, you're not getting the full value what your case is worth, but also $1 today or $500 today is going to be worth a whole hell of a lot more than $500 at the end of that cap in 7.7 years. Who knows, especially the way inflation's been going, who knows what $500 is going to get you 7 years from now? You probably can't even fill your gas tank. So just things to consider. And these are why having a good lawyer is very important. And my mama says I'm a good lawyer, so you should call me. Boy, I'm thirsty today. How does a non-schedule loss of use award work with multiple injuries? What if one is a scheduled loss of use? So we talked about this yesterday. You have multiple injuries, and you might have all non-schedulable injuries. You might have a head, neck, and back injury from a car accident. You might have a head, neck, and back and left shoulder, right shoulder injury. So now you have some schedule injuries in there as well. How do we assess this situation? Well, if there's schedule and non-schedule cases, if there's extremities involved here, the big factor you need to look at is are you working, and are you working at full duty? If you're back at work working full duty, earning the same that you were earning before your accident or more, well, then your head, neck, and back case is really not going to have much value. I literally just, the last client we finished up with, we had this exact conversation. He came in with his wife. She got hurt, unfortunately. We're going to help her out too. But as bad as your back is, you're working. You went back to work, and God bless you for doing it. But the back no longer has really value, a lot of value. It has value in terms of buying out the medical potentially or things like that. But you have to be out of work for a non-scheduled case to have monetary indemnity value to you. But if you are out of work or you're working at reduced earnings and those injuries are impacting your day-to-day and you're not working, they look at you as a whole. So they might consider that you have a G severity to the back and an F to the neck and a da 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 da. But they also there's a spectrum of work capabilities they ask the doctor to fill out. Very heavy work, medium work, light work, and sedentary work. The doctor's supposed to tell us which category you fall into, what type of work you're capable of, considering all of your injuries. So the schedules and the non-schedules, the head, neck, and the shoulders will all be considered overall to determine how much disability you have as an individual. It's a great question I posted for myself, so I'm happy with that. The focus, and this is one of Sai's comments, so we got to give him credit. Give credit where credit's due. The focus is on your total loss of earning power rather than treating each injury separately. And whereas scheduled cases, if you have a wrist and an elbow and a shoulder, each injury is handled separately, and then the bottom line is combined into one lump sum of money. Sai, good job, my friend. Explain. We did that. Next slide. How is a non-scheduled loss of use award different from a settlement? And do you have to pay back money like an SLU award? So non-scheduled awards allow ongoing medical care, and many settlements don't. When you do a Section 32, a full and final Section 32, like we've discussed, and we're going to do another live just talking about 32s and what's a Section 32 and what are the different types of Section 32. And I am gonna throw this comment up there. Is it different from state to state? Because Duran C, Michigan is yelling at me. Yes, it's different from state to state. Every state has their own workers' compensation system. Every state has their own workers' compensation laws. Every state has their own way of handling things. So it is different from state to state. They might be similar. They might have similarities, and I'm sure there are from state to state, but every state is different. So when I talk about Section 32 here in New York State, that might not be, it might not be that's certainly not what they call it anywhere else. And the intricacies are different. So it is different from state to state. I am only licensed and I only practice here in New York State. So please keep that in mind. But as always, I'm happy to answer questions from everywhere and anywhere. But yes, it's very different from state to state. Keep that in mind. Now, like I said before, when you have a non-scheduled loss case, you do, if a judge finds your loss of wage earning capacity and puts a cap on you and says you're going to get this much money for a period no greater than this many weeks, you are entitled to ongoing symptomatic maintenance type of care, palliative care. So it's not, they're not saying you can never treat again. Technically, the doctor is not supposed to assess you for your permanent disability until you have reached maximum medical improvement. The judge is not supposed to adjudicate your level of permanent disability until you have reached maximum medical improvement. We've seen some wacky and crazy things, but putting that all behind, if you do need ongoing maintenance care, palliative care, symptomatic care, whatever you want to call it, you can still go for that, even if you've been adjudicated to have a permanent impairment. If you settle your case with a Section 32 or any full and final type of settlement, usually medical gets shut down and closed with it. So the treatment becomes your responsibility to pay for out of your settlement proceeds. Non-schedule awards don't require repayment of back money. So like we talked about yesterday with a scheduled loss of use case, if you have a 10% permanent disability to your shoulder, that's worth 31.2 weeks at $1,000 a week. That's $31,200 that you're entitled to, and you've received $6,200 while you $6,200 in weekly awards while you're out of work. Well, then you're going to get a check for $25,000 less your attorney's fee if there is an attorney. They do take credit for prior payments. With non-scheduled cases, they don't take credit for prior payments. It's just a continuation of your ongoing awards. You guys know my pro tip for injured workers with non-scheduled injuries. Honestly, it's a maze. It's there's a lot of pitfalls that you could run into. You've got to be very careful with non-scheduled cases. And it's really important you have a lawyer who knows what's going on. And if you have a lawyer, please keep your lawyer in the loop. Please let your lawyer know what's going on. Please have discussions with your lawyer before you make some big decisions. It's important. If you're going to go back to work, talk to your lawyer. What are you planning on doing? How much are you planning on earning? You know, we've had clients that say, I went back to work. Okay, great. And I tell them, let me know what you're earning. If you're earning less money, you might be entitled to reduced earnings benefits. And then they disappear on me for 6, 8, 10 months, a year. And next thing I know, they come back to me and they say, I stopped working. And then I look back at their pay stubs and I'm like, you could have been getting reduced earnings benefits here for the longest period of time. Where the hell have you been? Oh, I was busy. Well, you shouldn't be that busy because I'm here to help you. Talk to your lawyer. Get a good lawyer. Talk to your lawyer. Okay. Communication is key with lawyer client relationships and with spousal arrangements. Communication is key. If you need a lawyer, please call me 212-406-8989. I am Rex Sikowski and I'm here to help. Let's jump into some of your questions because you guys always have great questions for me. Let's close out these notes. I'm not going to save you. All right. It's opening day, people. Let's go. Baseball time. PM Galleria wants us to only do a one post policy so everyone gets a question in. I understand there people have, just keep it civil. That's my rule. Just keep it civil. I will do my best to get to as many questions as possible. Post them early. That's my rule. If you want to get your question answered, post them early because I'm only, if I pull this open, there's not an S underneath here. I do run out of gas. You've seen me do it, and I gave you my blood and tears yesterday, and I'm going to do what I can for you today. But it is exhausting, and I'm so happy to do it. But Natalie, hello Rex, hello Natalie. Great videos. New York workers' comp for over a year now. The judge asked for my summation. What does that mean? Well, do you have a lawyer? The judge ordered doctors to depose. My doctor is still asking to approve treatments. Fine. Summation is a summation. It's a summary. So what probably happened here is the judge ordered depositions on a particular medical issue. Could be degree of disability, could be need for treatment, could be both, could be permanent disability, could be whether you've reached MMI. There's a lot of different factors here, a lot of different medical issues that he could have asked about. And he's asking for depositions, or she's asking for depositions from your doctor, from the insurance company doctor. And once it's all done, they want your summary. Well, Judge, we believe that Natalie has not reached maximum medical improvement yet because Dr. Smith says she still needs shoulder surgery, and Dr. Jones says she still needs chiropractic care for her lumbar spine and potentially might need another MRI. So we don't believe maximum medical improvement is ripe yet, and we don't believe a permanency evaluation should happen at this particular moment, and we believe she maintains an ongoing 80% partial disability. And then the insurance company is going to say, our doctor said that she's done with treatment and she's finished and she only has a 5% permanent impairment. Cut her off and get rid of her. Summations are usually they're written. They can be oral summations given at the end of testimony or in court, but that's what the judge is asking you for, or asking your lawyer for when he talks about summations. Good question. You know what? I didn't give a lot of gold stars yesterday, and I like that question. So it's gold. It's getting the gold. You get the gold. Here, Sai says, my recommendation is to post your question as early as possible instead of waiting because Rex is a big baby and gets tired. Rain and Dreams. I had a TLIF L45 and the L5 S1 last year, reached MMI. What's next? Well, if you're at MMI, if you reach maximum medical improvement, and your doctor, I'm assuming you're in New York, your doctor should be filling out that C4.3 form and telling everybody how severe and how disabled you are. Are you working? Are you not working? Are you working at reduced earnings? Are there other body parts involved in your case? How much what was your average weekly wage? A lot of factors here, but you're in the home stretch. If your doctor has determined you have reached MMI, you're in the home stretch. PM, the hall monitor. I love it. How long does it take for a lawyer to evaluate your case value? Insurer asked for a demand and my lawyer has not come up with one. It's been 3 weeks. I mean, that 3 weeks is, your lawyer's probably just busy. What I recommend, if you're trying to push it here, call a lawyer, call his office, get his receptionist on the phone and say, I'd like to make an appointment to come in and see my lawyer and discuss my case so we can come up with a settlement demand, and go and sit down. The clients that show me the initiative and tell me what they want and help me and come in and sit down with me and help me evaluate their claim, you know, they're gonna get, I don't want to say they're gonna get more out of me, but you know, we're in it together. And when you're sitting across the desk from me and it's me and you and it's quiet in here and I don't have to listen to the phone ring and I'm not doing something and you have my undivided attention, yeah, we could sit here and hammer out settlement values and send in demands. That's what we do. That's what all my loose leaf papers with numbers and scratches and scribbles are about. It's me sitting here with clients talking about, is there anybody's name on there? What's your case worth? Obviously I'm a visual type of person, arrows and cross multiplication, but this is how the sausage is made, folks. Go and talk to your lawyer, make an appointment, sit down with them, hammer it out. This way you know what to expect. You know what they're asking for. This way you're not going to be one of those clients that say, oh my God, I got a letter in the mail that says I'm going to get $150,000. No. That's what we demanded. That was our initial salvo. That was our opening shot. You're not getting 100. That's what we're demanding. So you're going to probably come in under that. Be somebody who can be in the know about their own case, and that's how it goes down. Make that appointment. Call your lawyer, make an appointment. Probably the best thing you can do. Great question. You know what? PM has taken the world by the horns. She wants decorum. She asked a good question, or he. I mean, don't want to make assumptions here, but there you go. You deserve it. You worked hard for it. Plus 100. I've been off for 6 months, had arthroscopic surgery for ACL, MCL, not my meniscus. How dare you say my meniscus was involved? How do I get that added? And what do you think a settlement for a case like that is? Full ACL rupture. My case went to the Industrial Commission and I won and I still haven't been paid yet. Are you a local 3 electrician? Plus 100. And is it scheduled or non-scheduled? Well, if it's just the knee, it's a scheduled case, unless it's so bad that it pops you out of the schedule world into the non-schedule world, and you would get potentially evaluated for non-schedule injury. But usually a knee injury is a schedulable injury, and that's how they address it. How much is it worth? Hard to say. It comes down to your range of motion after you reach MMI. Could it be 20%? Could it be 25%? How good did that surgery help you? How bad are you after surgery? Can you even walk? Everybody's different. Everybody's different. I had a friend who got bilateral total knee replacements at the same time. He's one of the few people out there. I don't want to use any bad word, but he's a good guy, who had both knees replaced at the same time. Usually you do one and you do the other. He did them both at the same time. And the guy, and he's not a young spring chicken. He's out there playing ice hockey and doing things. And he's got less hair than me, but he's out there doing it. And he responded well from his surgery. My father, on the other hand, had one knee replaced and his knee kills him. So the response to particular treatment, he is older than my friend, but people respond differently to surgery. Surgery is supposed to help you. So it really comes down to how your range of motion is when you've reached that MMI level. Good question. Murph, I had a wrist injury, turned into nerve damage, carpal tunnel, sent out a demand for settlement, 30 days, no response from employer's insurance. Now their doctor has cleared me to return to work at full duty. What should be my next step? Well, 30 days, I hate to say it. I send out demands to settle cases all the time. And it's like, it's a crapshoot as to who's going to respond, when they're going to respond. We don't have authority. We're working on it. It drives you loco. But 30 days isn't a long time. It sounds like you said you did it yourself. So just, honestly, there are cases where I set a reminder once a week, once every 2 weeks, once a month. Hey, where are we at with this? Get me an answer. So don't be afraid to be a little bit persistent. As my one friend says, persistence overcomes resistance. Oscar's in New Mexico and he has medication mediation. Man, if I could, it's because I'm not wearing the glasses today. I'm working off my contacts. I have a mediation coming up next week. I got the exhibits from the EIO, and I believe there's some bad faith proceedings by adding information not related to the initial complaint, like 3 write-ups. The employer got the exhibits from the employer. Okay, like 3 write-ups. I never had a write-up in my employment. I'm at my MRI appointment at the moment, and I'm preparing to respond to their false statements. The airbag at work deployed without cause in their company vehicle, but not to assume responsibility. They want to say I hit a barrier first when there was no barrier or pole. You are asking me for a full brief. You want me to write your brief in response? I don't know what's important and what's not important in front of the New Mexico Workers' Compensation Board. We don't handle cases this way. We don't do mediations per se. We just, I mean, maybe it's the same exact thing, just a different name. But do you have a lawyer, Oscar? You really need to get one, because especially if they're controversial, anytime your case is being controverted, fought, objected to, whatever words you want to use, you should have a lawyer. Going at it alone is just, listen, we're all human beings and we all have capabilities. I certainly could change the oil in my car, and enough YouTube videos would probably help me get to the point where I did a decent enough job, but it would take me 10 times longer than bringing it to a professional and probably cost me triple because I'd F something up. There's a reason why people do what they do and go to the professionals. And that's an oil change. You have a legal matter here. Talk to a lawyer. That's really my best advice for you. I couldn't really give you any much more spot on information than that. Talk to a lawyer. Oscar, but I wish you well. Kelly, can insurance company make you have surgery within a certain time frame after approval for said surgeries? One is dangerous surgery, so I'm frightened. Okay, a couple takeaways from this one. Number one, here in New York State, generally speaking, there's no expiration date on a surgical authorization, but a change in facts surrounding that authorization, a change in circumstances could change that authorization. Nobody can force you to do anything. Those days are over. Talk to your doctor, figure out a time frame and a schedule that's good for you based upon your injury and your treatment, and follow that plan with your doctor. That said, the dangerous surgery thing, and yes, surgeries have inherent risks, and your doctors are required to tell you about those inherent risks, and we know all that. But people are far more afraid of surgery than they really need to be. People come in here all the time. They're like, my doctor wants to do spinal surgery, but my cousin's nephew in Guatemala who's married to blah, 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 they knew somebody once who had a friend who was paralyzed because he had his tooth pulled. No, it didn't happen. Relax. And if it did, it was in like 1812. Surgery is, they're there to make you better. They're there to help you. And yes, there are things that can go wrong. Infections can happen. I totally understand it, but on the whole, you got to kind of just play the statistics here. Our surgery is there to help you. To just and people have fears, and I totally get it. Some people just say, look, I just don't want to do so. Okay, fine. But just be a little rational. If you're really considering having a surgery or not having a surgery, talk to the doctor about what to expect, what the possibilities are, the good, the bad, the pros and cons, and make an informed decision. Don't just be afraid. There's a lot of fear that and I see people that they're so afraid, then they go and have their surgery, and then they feel great. So surgery is there to help you. And I'm not a proponent. I don't push surgery on anybody. If you need it, get it. If you don't need it, don't get it. But just the fear factor is something that, people just, I spoke to the guy sitting next to me in the waiting room of physical therapy, and he would never get a blah, blah, blah surgery again. Oh, he's not your doctor. So please, and he's not your lawyer either. Josh Gardner, spinal specialist, says I need a lumbar discectomy. Can I ask for a settlement now? I have a lumbar discectomy and I need cash now. You can ask for a settlement anytime you want. You can always approach, if you're choosing not to have your spine surgery, your lumbar discectomy, and you just want to close your case, you could certainly approach the insurance company and try to settle the case at that point in time. It's totally up to you. Talk to your lawyer and talk to your doctor. Know what you're giving up by not having the surgery, by settling your case, and know what you're getting on both ends, the medical and the legal end. You got 4 bulging discs and 1 needs the surgery. So you probably have encroachment. all that good stuff. Talk to your doctor, talk to your lawyer. Big. Keith Jones. Keith from California. In my workers' compensation case, my body part is brain, upper and lower extremities. Is this ULU or SLU? Here in New York, that is a non-schedule type of case. But California, I don't know. I simply don't know, my friend. Epic Hood Stories, NYC. From the judge once in... Wait a minute. Did you start talking somewhere else and I missed it? My friend, Epic Hood Stories, I don't know where your question starts and I can't find it. It's almost as good as size question. Huh? I've never been diagnosed or had anxiety, but I got injured, I had a spinal fusion, and now I have anxiety. Go see a doctor. If you think that you have clinical, treatable anxiety, go see a doctor. If you think if it's impacting your life, go see a doctor. If you don't have one and you don't know one, talk to your doctor that's treating you for your physical injuries and ask if they know somebody. If you have a lawyer, ask your lawyer. It happens. A work injury is a significant event. If you're losing time, if you're hurt, there are, I don't want to make you feel worse, so I'm going to shut my mouth. But being at home hurt sucks. And that could have an impact on a person's mental status. And I'm going to leave it at that. I don't want to paint too dark a picture. But we it's the truth. If you need the help, get the help. Soul Train. Josh, spinal specialist says I need a lumbar discectomy for one of my bulges pushing on my spine, causing weakness in both legs. I don't want a surgery, though it scares me. Can I settle? Yes. You just asked before. Did you not, Josh? Yeah. Yeah. You can. If you're willing to give up your surgeries, you can settle. Talk to your lawyer, talk to your doctor. Kelly in New York State, can an insurance company make you have surgery? We did this one already. Guys, but your lawyer says you can't settle now. Your lawyer, ask him why. Ask him why. Ask him why. The natives are getting restless out there. I can think of one. I can't think of one. I can't think of one. How do they calculate your shoulders if you injure both at the same time? Are they done separately? Yes. Range of motion of one, range of motion of the other. Figure it out. 10%, 20%. Catherine is giving me the Ross. Apparently, I'm too loud for my own office. It's my office. I do what I want. You don't like it? Man, this is what I get. I'm trying to help people loudly. They're assessed separately, and then the values are added together, and that's how they're paid. So that's how we do it. This is how we do it. I have injuries in my back, my arm with surgeries in both. Case of a settlement, how it works. In case of a settlement, how does it work? Are you working or you're not working? Are you going to go back to work if you're not working? Are you working at reduced earn? I have about 18 questions I need the answers to before I can tell you how it works, but I can help you, and I'd be happy to help you. If you want to call me, 212-406-8989. That's my number. That's how you can find me. I am going away for 2 weeks, folks, and that's why we're doing a double banger this week, yesterday and today. I'm going away, taking the family on a nice vacation. We are going away. We are going away, and we're going to enjoy it as much as I can. We're going away. Truth Seeker always asks questions that are fantastic. Have I ever dealt with bradycardia before? We have. I know we have. I just need to remind my brain of what that was. It's when you watch too much 70s sitcom and you get a heart attack. Bradycardia versus tachycardia. Bradycardia is a heart rate that is slower than normal, typical below 60 beats per minute, which is a normal finding in some individuals, especially athletes like me. If it's work related, a low heartbeat, I mean, I would need, if somebody walked in new, fresh, and asked me about a case like that, my question would be, I need to see medical showing A, how that's disabling, and B, how it's related to your work. But if it's both, I'm happy to help you out. There's reasons why I'm not a cardiologist. A few more minutes here, folks, and we're going to start wrapping it up. Oh, man, a bunch of questions just came in. Baba got injured 3 weeks ago, and this channel is helping me understand what's going on and how to navigate it. Thank you, sir. What's going on? What's going on? I'm happy to help. Thank you, Baba. How much is a herniated disc workman's compensation settlement worth with doctor recommending microdiscectomy? $87 billion. It could be worth a lot. It could be worth nothing. We need to know what your work status is and your earnings. Those are some big factors. Troy, Dion, and the Belmonts want to know, do settlement payments stop when you are medically retired from a job with a pension? Should I ask for a lump sum payment? Really depends on your state and the specific laws in the state, and it could. You could be, you got to be careful. Retirement is a big issue. Talk to your lawyer if you're getting ready to retire. Kevin, slippery floors and not trying to fall will tear up the ligaments after a while. Went through that at Walmart for a little over 7 years. Very painful. Yeah. You don't have to fall to get hurt. Sometimes just that little hurt is enough to do it. And if you hurt a couple times a week because you're walking on slippery floors, it could really mess you up. So Kevin, let's go after Sam Walton and his cronies and get you what you're entitled to. Ebo411, hey Rex, been out of work 4 months now, still treating, had my first IME, was put as 100% disabled. You got him. I have underlying conditions, also prior amputation to the injured area. The last couple of days, you guys just slide that in there. Will the insurance company give me hell? The insurance company gives everybody hell because that's what they specialize in. The IME is finding you totally disabled, temporary totally disabled. That's helpful. It should make your life a little easier for a period of time. It should get you, total benefits. It should make the pathway to your treatment easier and better. Do you have a lawyer on that case? I want to make sure that when the hell does come, that you have somebody there by your side, ready to kick some ass when they start messing with you. Make sure you have a good lawyer on a case like that. Kelly wants to thank me for my assuring words, and I want to say you're welcome, Kelly. That's what I'm here to do. Josh, I meant to ask, what's the worth? Sorry. People ask me, what's it worth? I don't know. We need to talk to even start to get into a realm near anywhere to give you a range of what worth would be. What happens if you refuse surgery? You don't have to have surgery. If surgery is the end of your line treatment-wise, maybe having a surgery, having your post-operative care would be your point of MMI. Sorry. And if you don't have the surgery, maybe you're at MMI now. Maybe it's time to get a permanency evaluation and get things done and wrap it up. Child of God, doctor didn't put in a request for approval for physical therapy for non-scheduled body parts, which should have been done December. He's telling to go ahead and start. Should I wait for approval? Talk to your doctor. Listen, physical therapy is one of those things that people like. And every injury is different, and I'm not a doctor, and I'm not the one to talk about whether you should or shouldn't have physical therapy. I'm just going to say this. I've seen a lot of times where people need and want and are benefited from physical therapy, and then, cases closed, cases settled, cases whatever. And I've seen people go to their physical therapist or go to the doctor and say, look, I can't come to you anymore, but what can I do at home that's going to make me better? And the doctor says, go on Amazon, buy a TheraBand or whatever knockoff of the elastic bands, tie it into your doorknob, and you can work out your shoulder and your elbow like this. Put it under a chair and you can work your leg out like that. There are home exercises that I've had clients learn that kind of get them that relief, and they could do it at home at their own leisure whenever they need it, and they're not stuck to a schedule. And sometimes that's a possibility. That's all I'm saying. I'm not prescribing home exercise. I'm just telling you to think about it and talk to your doctor. Hi, Rex. Hi, Curtis. It's the truth. I'm the truth. I'm the Allen Iverson. Is it Allen Iverson's the truth? Or is he the answer? Getting old. Curtis learned a lot from my channel. Thank you. You guys have great questions, and I'm happy to answer them. I have a New York State case, and the insurer does not reply to the notice of indexing, and court is coming up. What can I expect? Out of work since December, and the doctor keeps me out of work. Well, if you got a notice of indexing, does it say EC84 in the bottom left-hand corner? If you have an EC84 notice of indexing, and the insurance company is ignoring it, and 25 days go by, they really can't contest your claim at that point. So don't wake them up. Sit tight. Let time pass. Let their time frames expire. It's only going to give you a little bit of a benefit if they drop the ball. So You're going to be okay. Well, I can't say that because I don't know you. I don't know your case, but EC84, they have a set time limitation, 25 days. That would be a 25(2)B violation, and 25 days. I'm right. Always right. Hurts. They have 25 days from the filing of an EC84 to raise controversy. There are some issues that they could raise at any point in time, coverage being one of them, that they had, whether or not they had valid coverage, but they do lose the right to certain defenses, big defenses in your claim if they drop the ball and they don't answer in time. So keep it in mind. Sometimes you don't want to wake the sleeping dog, is what I'm saying. If you're at MMI and given permanent work restrictions, can they ever be changed? Sure. Sure. People's condition changes. Listen, look at a healthy 40-year-old and then look at that healthy 40-year-old when he becomes a healthy 80-year-old. He's going to have different restrictions. He's also going to shrink over time. So things change. People change. Yes, it can be changed. Hey, Rex. Hello, Marcos Bermudez. Central Coast 831. Have you ever took a case? I have taken a case involving post-concussion syndrome and movement disorders. Yes, we have PCS cases all the time, unfortunately. Yeah, it sucks. Jetwing 67, let's go Mets. It's opening day. The game started. MLB Network and SNY. Let me find that. SNY screwed me. Now I have to get the MLB app if I want to stream because I don't have a cable box in the office. I just want to watch the Met game. I just want to watch the Met game. I just want to watch the Met game. I'm not asking for much. I got to go back to 1986 and throw the radio on and listen in the background. Like, I just want to just put enough with the stream. You guys make so much effing money that now I got to pay you another $150 a year to watch a baseball game. Cut the crap already. Stop milking people. It's the national pastime. Stop milking people. It's not right. It's not. You make enough money. It's not right. Let's go Mets. Soto makes enough money. They all make enough money. Let's go workers' compensation. Well, that's funny. Richie Chop. Thanks, Rex. Appreciate the info I received from you over this nightmare workers' compensation horror show. Yeah, listen. I never said it's a fun place to be, but I like helping people that are there. Chris Ashley always has good comments. My case started in 2021. I had microdiscectomy surgery, L4-5, decompression surgery, radio frequency ablation on both sides of my back last February. Still treating. Should I consider closing the case? You clearly have significant back issues. Talk to your doctor. Find out what the future holds, and maybe if there's nothing significant on your treatment horizon, maybe it is time to start thinking about it. Sai has the comment of the day where if you do like the video and you find it valuable and you like hearing what I have to say, don't forget to hit the like button. Don't forget to subscribe. Don't forget to ask questions. You guys are help me help you. Help me help you. Paul Pierce was the truth. And Al, I'm such an idiot. I was never a big basketball guy, so give me that much. And I caught myself when I said Allen Iverson was the truth, and I said, no, he was the answer. So I caught myself. So I'm only going to get half credit, and I'm okay with that. We're good. Josh Gardner, how do I start a demand? That was very Ted Kennedy. How would I start a demand letter to the workers' compensation adjuster? Key points. Hi, I'm interested in evaluating my settlement options, and this is my demand. I mean, it's hard to really say because, this is another reason why having an attorney is important, and it's not because they can tell you how to make a demand. We also kind of know who the players are, and I know the different adjusters and examiners, and I know the different lawyers and the different people you got to talk to, and there's some people you can deal with. It's not what you know, it's who you know. It's who you know and how you have to deal with them. Certain people you have to play hardball. Certain people you could schmooze and get an answer. Certain people you can, there's some adjusters and some lawyers that are a pleasure to deal with because they know what the value of the case is. They're not going to lowball you. You get right to the heart of it. And it's nice because you get a settlement worked out and you can talk about Mets baseball with the rest of your time on the phone, rather than sitting there and bitching and moaning at each other to try to get to a place that's reasonable. And we know who the players are in a particular case. And, people that are pro se don't necessarily. I mean, you should know your adjuster if you've had the same adjuster over a long period of time. But that's just another reason why you should hire a great lawyer like me. 212-406-8989. Central Coast, our post-concussion syndrome with movement disorders. When you say with movement disorders, I'm just assuming it's a yes. Are they difficult? Are they hard to win? They can be, and they can be quite easy. It really depends. It really depends on the facts surrounding the case, the nature of the accident itself, whether they're controverting the accident. So it could be hard, could be easy, it could be an accepted case without controversy. Paul, I had spinal fusion surgery. Now they want to put a spinal cord stimulator, but I don't want to do it because it's hard living off workers' comp. I will just deal with the pain. One thing to consider with spinal cord stimulators are, we're seeing more and more of them lately. When you do get a spinal cord stimulator implanted, you need a battery change in, I forget if it's 5 years or 10 years or more or less than that, but you need to have the battery changed. And people go and settle their case. You keep that as a consideration. If you settle your case and you close out the medical, it's on you to change the battery. And that's not cheap. And it's a surgery. They cut you open and open the machine, and like a remote control, they change the batteries. So keep that in mind when settling your case. With that, folks, I am going to say thank you. And you guys did a wonderful job. I didn't get to my Instagram questions. And I'm sorry. Call me, please. 212-406-8989. That's me. That's my office. That's my wonderful staff. Rex Sikowski, we're here in New York State. We handle your workers' compensation claims. We do everything we can to help you. We also can help with Social Security disability cases. We work with some great attorneys that get some great results on Social Security disability cases. Personal injury matters. You should see some of the results that we're seeing on these cases. It's fantastic. People are really getting the help that they need. And it's really, it feels good to help people who need help. And you know what? It's nice making a living off of it. And I'm not like SNY, and I'm not like MLB that's just sucking the freaking life out of everybody and taking every penny they can just so you could watch a baseball game. I'm here to help you, and I'm not here to suck you dry like Major League Baseball. I want to watch the game. So thank you. And if anybody has any questions, please, as always, 212-406-8989. That is our number here. I am taking a break for 2 weeks, but we're going to come back. We're going to hit you probably with the greatest topic ever in 2 weeks when I'm back. And until then, folks, thank you very much. Have a wonderful rest of your day. Be safe out there. Thanks.